So, what does stage 2 look like? Restaurants can open for dine-in as long as protocols are followed. Indoor gyms, recreational facilities, hair salons, and other close contact surfaces can open as long as protocols are followed. Bars should begin making plans to open in stage 3, and protocols for opening will be posted at rebound.idaho.gov on Monday. Just like in stage 1, there's no requirement for people to self-isolate, but vulnerable individuals are strongly urged to continue to self-isolate if they can. Employees should return to work in phases and continue to telework whenever possible. We should all minimize non-essential travel. Gatherings, both public and private, of less than 10 people can occur where appropriate physical distancing and precautionary measures are observed. Large venues, such as large sporting events, movie theaters, remain closed until later stages. 90% of Idaho businesses were able to be open their doors on May 1st. Many more began offering curbside services since mid-April. And with our plan to enter stage 2, over 95% of businesses will be able to be open their doors starting this Saturday. President Trump, Vice President Pence, White House officials have repeatedly praised Idaho's staged approach and our handling of federal relief funds in prioritizing small business support. Idaho is truly a leader for other states to follow, and we have a lot to be proud of. Meanwhile, we're working to strengthen our capability to deal with a second wave of infections if that should occur. We know an expanded and targeted testing strategy is closely linked to a strong economy. We expect 40,000 additional test kits to arrive throughout this month, and we just received the first shipment of 8,000 testing kits last week. Our testing task force is closing in on an updated strategy that prioritizes targeted testing for high-risk populations, including long-term care workers and patients. In the 400 long-term care facilities in Idaho, there are robust plans in place to isolate COVID-positive cases. Just 20 facilities have had cases, and half of those no longer have active cases. On contact tracing, the process epidemiologists go through to trace back a COVID-positive person's possible exposure, we have quadrupled our capacity in the past 4 weeks. We're meeting current needs, and we continue to work by adding more staff and better tracing technology. In addition, Idaho is partnering with the Idaho National Laboratory and Battelle to decontaminate N95 masks, strengthening our healthcare system capacity and our ability to protect healthcare workers as they treat COVID-19 positive patients across the state.